We've just had 10 years of me going through brain surgery, and to find out this, we thought it was all over and done with, and then this drops in. You know, it's a lifetime of worry. Worry just runs away, doesn't it? With you know, the what ifs, and there's no treatments, no cures, so if it comes, that's it.
Paul Davey is a self-employed builder from Essex, and his is an extraordinary story. In 2007, Paul had 2 operations after suffering an aneurysm, a bleed in his brain. The operations seemed to work.
Got given a letter to say that I was cured, and then in May last year I was given a new letter to say maybe I wasn't cured.
Right, and what did that letter say?
It said that I'd been put at risk of a prion disease.
Paul received a letter from his hospital out of the blue, telling him that the mother of a patient who'd had an operation in the same theatre had developed an inherited form of CJD, a fatal brain-wasting condition. That patient was later found to be carrying a gene that meant she too could develop the disease. This meant there was some risk to Paul and the other 20 patients who received the letter. So what's the issue over cleaning instruments that meant Paul still ended up at risk? After brain surgery, surgical instruments like these are cooked at 134 degrees Celsius for half an hour to kill off anything infectious they might be carrying. But for CJD and other prion diseases, that's not enough, because prions can't be killed by ordinary sterilisation techniques. So surgeons use disposable instruments. The problem comes if a patient is only found to be carrying CJD later, because any other patients on whom these surgical instruments have been used could have been infected. Despite talking to his consultant, Paul still felt it hadn't been made clear exactly what risk he faces.
Why'd you send someone a letter when they're making out they don't know? It would have been better the letter not being sent at all. If the chances were that small, why did they send the letter?
What do you think?
I think you can't tell someone in a letter that you can't give blood, you can't visit dentists, and then tell them it's not serious.
The Queen's Hospital in Romford, where Paul was treated, says it followed all the current procedures correctly and is keen that patients in need of life-saving surgery should not be put off.
Well, I think the difficulty is not knowing what the risk is. And although, as I understand it, the Department of Health and its expert panel considered this at some considerable length, the problem was that they thought the risk was very low, and there was even some debate about whether or not people should be told, but it was felt that people should be given information, and it was also felt that it was important to protect other members of the public.
But is there something else that could have been done to lower the risk to patients? With the discovery in the mid-1990s that mad cow disease, or BSE, another prion disease, could pass to people, the government put some money into research to deactivate prions on surgical instruments. Professor John Collins is one of the country's leading prion specialists. With the help of that money, his team developed an enzyme-based soak, a bit like a biological washing powder, and found a commercial partner too. But it's not being used in hospitals. Is that a frustrating position for you to be in?
Well, it's frustrating as a scientist being funded by the Department of Health to do this research to solve this problem. We had quite a sizable group of scientists in the unit working on this for about 5 years. So, we felt we'd made quite an achievement in producing something that worked.
So if the technology's out there to minimise the risk of passing CJD on through surgery, what patients like Paul want to know is why we're not using it. The company working with Professor Collins said it decided not to promote its prion deactivator. At least 2 other teams also came up with solutions, and both had commercial partners. One told me hospitals would only be prepared to adopt its method if legally required to do so. And the other said there was no incentive for hospitals to use it, and referred us to the Department of Health.
Well, I understand it that the Department of Health now doesn't generally give sort of central diktats to NHS trusts how they do these things. Rather, it's at the level of the individual hospitals how they manage these things. So it is frustrating, yes, that this doesn't seem to be joined up.
Would you like to see the government take a fresh look at this area and consider whether there's something needs to be done?
It would be worth looking at the way these decisions are made and sort of joining up decision making really on this.
Conservative MP Sir Paul Beresford wants the Department of Health to step in and ensure such products are used, and he's trying to force a Commons debate on the issue tomorrow.
I think if the hospitals were under pressure and if the resultant cleaner was provided at a commercially viable cost, which I think would be low if they had a huge market, in other words every single hospital in the country, then the cost would be lower. But the other side of it, of course, is the prevention, and the prevention of having absolutely mortified people who get these horrendous notices saying that they are at risk.
We could feed a few maggots in and get a few perch interested if we had maggots, because they're greedy little monkeys.
Paul is having to cope with his own anxiety and how best to explain to his young family what it all means.
When you show people the letter, it's like, oh, well, it's only a small chance, but imagine if your name was on the letter.
Paul and other patients like him may need some convincing that the current stalemate over using these technologies won't just mean more people getting letters like his over and over again.